Good afternoon, everybody, and thank you very much for attending this online workshop. When we first started to plan this, Simon and I looked at this perhaps 2 or 3 months ago, and we were sort of looked like we were coming out of COVID, and hence the title was, in the past tense, what did COVID do to your practice? But I think that may have been a little bit premature, as we're now seeing, particularly in the recent lockdown we've had here in Victoria. In fact, that was number 5, and in New South Wales, the first time they've actually gone into such a very deep lockdown. The COVID situation still has had an impact on many facets of the economy, in particular hospitality and arts area, health, which probably would have been seen in some times as being almost recession-proof, has proved to be not pandemic-proof. And some practices, GP practices, have seen a dramatic drop in income as a consequence of the sort of protocols that have been put in place, and the fact that people weren't going to see their doctors in the same numbers. So our 3 terrific presenters will be looking at some of the major issues affecting practices, but I think these can be considered as things that you can look at outside of normal, internormal, what we might call internormal later on, and particularly as they affect the value of practices and the sellability of practices into the future as well. Most general practice owners, I think, would be much happier to just be seeing patients than spending the considerable amount of time and energy that they are on matters that they wouldn't have had to worry about in the past. And I think this is probably taking away as well from some of the issues that are both people-based and technology-based, and we'll come to those as I introduce the speakers individually. Hopefully you'll come out of this with some good ideas and how to make your practices look better, be better, and perform better. The 2 areas I said that we're looking at are going to be people and technology, both fairly broad, but I think our speakers will focus in on a couple of different areas. If you have any questions, please use the raise hand and or the chat function, and we'll take those questions either during the presentation or at the end of each presentation. Happy to take questions at the end of the program as well. So let me introduce our first presenter, Simon Osborne. Simon has his own business called Practical Workplace Strategies, and he works on the DNA of healthcare organisations, looking at leadership, culture, teams, and something that I think is going to come out of this today is engagement. And he does so to create amazing workplaces where communication is clear, leaders are constructive, trust is high, and results are sustainably excellent. And he uses some well-known, internationally acclaimed assessment instruments to shed light on the ways to think effectively and work more productively, and has delivered more than 1,000 hours of coaching to leaders and executives across large and small workplaces. So Simon, if you unmute yourself and introduce yourself and start your presentation.
Great. Thanks, Larry. Thanks very much. Yeah, probably not a lot of need to introduce myself. You've done so really well, so thank you. I'm delighted to be part of the panel today and really looking forward to working with Shelley and Mike to provide you as participants with some practical hands-on strategies, some ways, in fact, to improve the quality of your practice, to improve the quality of the time you spend in your practice too. So it's the idea is it's a huge benefit for yourself to address some of the issues that certainly that I'm talking about, and I know that Shelley and Mike will. As Larry said, I spend my time working with businesses, helping them become amazing. I guess I've really noticed one of the sort of features that is so obvious with any workplace I've worked with over the years is that people actually really want to work in amazing workplaces, and they look longingly at other workplaces that, so how come they do ... You fill in the little bit yourself. So one of the critical factors in being an amazing workplace, as Larry alluded to, for me, is the extent to which employees are highly engaged. I'll just share my screen and bring up the presentation with the oh, there it is. That's better. Okay. So the three key areas that I want to address my comments to today are trying to create an understanding of what low levels of engagement by employees is costing a business. I'll explain a bit more about that as we go through. The second thing I'd like to do is give you some idea of what indicators you should look out for that might start to indicate to you, might give you the message that perhaps people are not as engaged as you'd like them to be. And finally, a few tips and strategies, a few ways in which you can start to make some change in the way the practice is managed so that you do become amazing. So from the outset, most businesses that I meet with do so not because they've got a burning problem. They will tend to be talking to me because they just have that sense that things are in crisis too often. Things are uncomfortably pressured. There's stress happening, and people are perhaps taking a bit of extra leave. There's all sorts of reasons why the business feels like it's not operating at its absolute peak. It doesn't have that sense of just humming along. So they tend to be dealing with the if onlys, or a sense that they can actually do better than this. So I guess by way of example, maybe I could talk about two different medical practices. And given that we're just coming out of lockdown in Melbourne, or have just come out of lockdown in Melbourne, let's put our minds back to the beginning when it was first announced that we were going into lockdown yet again. In the one practice, there was a sense of dread. There was a frustration, maybe even fear. The frontline staff felt under huge pressure to get things right. The overriding sense for them was pressure. And it was a matter of how do we contact all our patients with appointments to make sure they can have telehealth, to sort people, to ensure that people know that we've got screening in place for people who may have symptoms. How do we meet this imposition, this externally provided imposition? We've got no control over this. The doctors and the support staff all began to feel it was out of control as soon as the lockdown was announced. Put yourself in another practice where within a matter of an hour of the lockdown being announced, there was a sense of calm purpose in the organisation. People were absolutely focused and they knew what they had to do. In other practice, they had the processes and policies in place. They knew what they had to do. But in this practice, the urgency was still there, but everyone felt it was under control. The team was operating together. They knew what was happening. They knew patients wouldn't be disadvantaged at all. They knew that all their patients would get their best possible care. And they left at the end of that first day feeling energized by the sense of purpose they had sort of achieved everything during the day. Now, the difference between these two is what, as Larry said, I work on. The difference between these two practices is what I call the DNA, and that's the teamwork, the engagement, the leadership, and the employee engagement involved in that practice. So focusing on that last element, what are the costs of so-called disengagement? There are straight up financial costs. They come off your bottom line. You can see them in your balance sheet, but there's also a range of personal costs, and I'll talk about those in a few minutes. And thirdly, there's the cost of lost opportunities. When employees are disengaged, there's a lot of things that the practice could do but never manages to quite get there. And there's probably a list of them. You probably know yourself all those things you'd like to do as a practice, but somehow that we never get around to it because we get caught up. So let's start by looking at the financial costs. One of the bits of research from international research around businesses generally, this isn't medical practices alone, but businesses with highly engaged employees managed to achieve a revenue growth above the average in their sector by a complete 1%. And those with the low end of engagement end up being behind the sector's revenue growth by about 2%. So quite simply, by improving the engagement of your people, it's possible to generate an extra 1% in revenue. And that's an average over thousands of businesses. It's possible, of course, to do even better than that. Another financial cost is that in addition to revenue growth, profitability is better. So if you think about it, if you can beat average revenue growth by 1%, but your profitability can improve by 12, there's a massive amount more you're able to do with your existing resources if you've got highly engaged employees. And finally, one of the startling bits of statistics that I've found on engagement is the level of lost time injuries, and to have a significantly better lost time injury rate, then the implication for me is that there are other costs that people generally are not going to claim lost time injuries as their first resort. Or if they do, then there's clearly a question they've got in their head about whether they're really committed to the workplace. But even so, if you can massively reduce the lost time injury rate, you can also improve your general health and wellness of the people in your practice. So that's that's three elements of the financial cost. The second you recall that I mentioned just before was personal costs. These are things that don't appear on your balance sheet. You can measure lost time injuries, you can measure profitability and revenue growth. Personal costs include things like stress. Now, I know that ultimately high levels of stress can play out in terms of lost time injuries, can play out in terms of absenteeism. But we know that when people are working under significant stress, they tend to be less effective. A cost that tends not to turn up on balance sheets, but in fact dramatically increases the costs to a business, is turnover. We know that when people have low levels of engagement with their work, they often are looking for another job. And there's plenty of data which indicates that. In fact, there's some data out of the US about hospital levels of engagement in hospitals, that some 56% of employees in hospitals are not highly engaged. And of that 56%, 43% are looking for another job. So you've got to wonder what they're contributing to your business if they're spending their time looking for another job, how committed they are. Another personal cost of lack of engagement and of generally not being an amazing workplace is the long hours that get put in. And I'll talk a bit more about some of that in a while. But a lot of the long hours tend to be error remediation, tend to be extra administrative effort to keep the business operating. The amount of unnecessary work, part of that's error remediation, some of it's because we're not fully understanding the opportunities that are available to us to reduce the administrative effort that we're putting into the business. Perhaps there's not enough delegation happening to people who should be doing the work, rather than a practice manager or the practice owner putting the time in doing it yourself. And as I said, error remediation, it's that spending time at the end of the day having to fix up the little problems, and often only small problems. They're not necessarily the big errors, the big compliance problems that we may be concerned to avoid. It's often the little errors that are just adding to that workload. And finally, in terms of the 3 levels of cost I wanted to talk about, there's an enormous amount of lost opportunity involved in organisations that don't have highly engaged employees. Part of that is driven by the fact that people in the organisation are spending their time, effort and resources trying to stay on top of everything that's in their current workload. And if we're focused on getting the job done today, which organisations with a low level of engagement tend to do, then we're not looking far enough out into the future. We're not seeking opportunities. There are lost opportunities because, as in the personal costs, that we're spending our time fixing errors. We're not looking at where the next opportunity comes from, not looking at creating something new and wonderful. Being stuck in current habits. A lot of change has happened and is continuing to happen in our sector of the workforce, and to the extent that we get stuck in the current habits rather than being open to new opportunities, and encouraging our employees, our staff, our partners to genuinely blue sky think about the opportunities that are available. What's something that's not currently happening, or what's something that the new technology is opening up for us? What's something that, talking in Shelley's terms, the opportunities we can get from patient feedback. What if we're so focused on our current business that we're missing those? And when we don't have high levels of engagement, we will tend to do that. And the other lost opportunity space for me in a lot of organisations I work with comes from the sense, the feeling, the simple feeling that we just don't have time. We don't have money to do this. Taking advantage of opportunities does not have to cost a lot of time. In fact, it can create extra time for you, and it doesn't have to cost a lot of money. It's certainly not in terms of the return that you'll get from doing it. And while it's impossible really to accurately measure these lost opportunities, I can absolutely guarantee you they're there. They're there for you to take hold of if you can really create an amazing workplace, a constructive and engaged workplace. So if some of what I've talked about is starting to ring a bell, let me run through a few symptoms, the sorts of things that each one of these might be a small thing. It might seem to be a minor thing. Yes, I know it's part of doing business. We've got to get used to that. We've got to do that. Okay, I understand that. But when you start to put them together in a long list, and this is the point at which I've resorted to a list of dot points, because I think it dramatically shows when you add up the list down the page, it can add up to a lot of time and effort. Let's start with one of the symptoms a disengaged employee or employees is that there's this effort to leave on time, or this urgency to get away on time. Or on the other hand, of course, it's those employees who feel they must stay long hours in order to be seen to be working hard. Neither is particularly effective. If there is a really urgent need for work to be done, by all means stay. And I'm sure that as owners and practice managers, you value that. And if a person has a particular need to be away from the office or away from the practice at a particular time for childcare responsibilities or whatever, by all means, understand that. But it's when they feel the need to, they've just got to get out. And as soon as they believe they can leave, they will, rather than put that little extra bit of effort in. It's the minor errors. It's the one, David Parkin is the coach of Carlton Football Club when he was there, he revolutionised football coaching in some regards by talking about 1%ers. And it's those rather than the main stats that were being collected at the time. And it's those minor errors, those little things that each one of them is not going to make a big difference to your bottom line, but then once you start adding them up, they do. People become territorial in less engaged workplaces. It's a matter of this, that's my work, or that's not my work. So the whole concept of team starts to fray around the edges, and people become irritable or frustrated if someone's doing their work. And I know it's important that we have job descriptions and people know what their work is, but it's the capacity to have each other's back in a really engaged workplace that just makes the place hum along. And compliance is a significant issue for you. I know that, but it's when the first focus from anyone is what's the rule, what's the compliance thing I have to do, rather than what's the best way of getting this done. How can we make sure we've done it? We've done it. How do we make sure we do it in a compliant manner? How do we ensure compliance, but really being amazing? Creating that experience for our clients and for our patients and their carers and supporters, that they just look back and say, wow, that's amazing. There was no risk, there was no lack of compliance, but it's that first step of compliance can be damaging. An organisation that operates without any disagreement, that superficial niceness, is often a danger sign. We know when there's big disagreements, we can deal with those, but be aware of the question. If a person's disengaged, they're not going to argue, they're not going to complain, they're not going to say when things are wrong. They'll just go along for the journey. They'll turn up for their paycheck, they'll turn up to do their job, and there'll be no dealing with issues to try to improve the quality of the business. People are often reluctant to make even small changes in disengaged workplaces. There's always resistance to change, I understand that, but it's that ongoing reluctance to make even small changes that can be quite damaging. Stress. I get that stress is a natural part of any medical practice, but when stress starts to become debilitating, and it's like it's the boiling frog. It's that often we're unaware of the extent to which stress has started to really impact on people's work effectiveness. And in less effective workplaces, disengaged employees or employees who are not fully engaged will either actively delegate upwards or passively just leave it to be done, because they know that the owner or the practice manager will just get in and do it. And then, so it just adds workload up the line. And finally, an attitude of having to win, the language of having to beat this, having to win this. it's understandable, but when it starts to become a competitive environment, and that's coming back to the issue there of territorial behaviours, even feeling competitive with other medical practices or with other services can impact on the extent to which we operate as a team. And people start to think of it as a competition rather than focusing on patient outcomes and having to get the best possible outcome regardless of who does it. So I'd be interested if you have any thoughts or comments about any of those sorts of symptoms or other symptoms that you notice in your practices that enable, that may be the starting point of questioning in your own mind, is there a bit of disengagement happening? I'm not talking about chronic toxic workplaces here. I'm talking about, as I said, the workplaces I work with often are places that, to all intents and purposes, are going okay. But there's the extent to which we can deal with some of these minor symptoms and really grow an amazing workplace, that's where the benefit comes. So, okay, to point out where the problems are, let me just start to talk about some solutions, some starting points to think about what might you change, what might you do that enables the creation of, if you've already got an amazing workplace, I'm delighted, and I'd be honestly delighted if you wanted to contact me and say, I've got an amazing workplace. But if you feel that we're not quite amazing yet, I often talk about the path to amazing. And so some of the solutions that people implement, some of the things you can do to get to head up that path to amazing, are things like being really conscious of the extent to which our communication in the business is genuinely proactive and two-way. Now, proactive in other words, rather than reacting to problems, proactively seeking information, sharing information, doing things which create an environment where people feel informed. Frequently over the many years I've been involved in organisation surveys, employee surveys and culture surveys and engagement surveys. One of the regular complaints by employees of organisations is no one tells us anything here. And then when I talk to the managers and the owners, their response is, but we're always telling them stuff, we're always communicating. So the issue is that that communication piece is a really critical one. Being conscious of, there's a whole lot of stuff you can't share, I recognise that, but there's an amazing amount of stuff that can be shared, which perhaps we don't think of doing. So that being conscious always of having a proactive two-way communication within the practice. The second solution, the second group of behaviours you can deal with are starting to develop constructive approaches to leadership. And I work on the principle in every organisation I work with that people can lead from any seat on the bus. It's not just the practice manager or the owners that need to be leaders. The issue is to be able to develop constructive approaches to leadership right through the practice. Every person in the practice has a leadership role. And that's things like from the senior leadership group, if there is one in the group of practices, it's about sharing overall business strategy. The extent you can actually share, where are we going? What's the vision of the future look like? People can buy into that. People can commit to that and feel excited by, this is where we're going, and I want to be part of that. I want to be on that bus. Being genuinely accessible for people, rather than a lot of managers and senior people I talk about being available, but their staff talk about that they don't feel comfortable in going and raising concerns. So it's that I may have an open door of an office, but do I appear to people to be open to their feedback? So seeking ways to support people personally and professionally. People don't leave their personal lives completely out of their thinking once they walk into a workplace, and being conscious of and supporting people in their personal issues as well as their professional development are really great ways of developing constructive leadership. Finding opportunities to catch people doing the right things. It's very easy as a manager, and I've done it myself too many times, where my focus has been on trying to prevent errors rather than spending my time trying to find people doing the right thing and praising them, doing stuff to thank and congratulate and praise them. Talking about people's personal goals with them, if we're going to help them develop, setting aside time on a regular basis to talk to them about what are your personal goals? What do you want to achieve? Where do you want to be a year or 2 years from now? How can we help you do that? Rather than seeing people in their little box in their current job. And as I said, thinking of everybody as having a leadership role. So different skills in the practice, different ways of operating, different perspectives on the practice can help a person generate change and generate leadership within right throughout the practice. Investing time in the improvement of workforce skills, the whole range of skills. So be conscious of developing technical as well as a whole lot of interpersonal and other skills for your people. Because the more rounded they are as skilled employees, the more benefit they'll be to you. I didn't say invest in cost in the improvement, because largely that cost is well and truly covered by improvements in output. Engaging people in decisions that affect them. When we want to change things, engaging people in how we change them and the nature of that change will deliver far better results. It will take longer. I know that. I promise you that I understand that. But engaging them in the process of understanding the whys and wherefores and how to change will massively increase their commitment to actually implementing change and making new systems, new processes, new ways of operating a reality for your practice. And then finally, creating regular forums, regular ways, regular discussions in which you can encourage people to suggest changes. Some of them can be really small process changes. It's little things that annoy them about their job or about the way things are organized, the layout of the reception area, the way in which we greet patients, follow-up systems with patients, all sorts of little things that we're used to doing and have operated well, but maybe there are ideas about things they can do differently. So that's the start. Feel free to contact me directly after this webinar to flesh those out. I'm more than happy to spend time just chatting to you about them. And then, so for me, at the core of solving this puzzle of creating creating an amazing workplace, there's always one, isn't there? There's always a typo in the overhead on the PowerPoint slides. So the core to solving this idea of creating an amazing workplace is creating constructive leaders throughout the business. When you have those, then shared and mutual goals are there and people are working towards them. There are high levels of trust. There are shared values. We know how people will respond and react when real crises happen, when problems emerge, when there's a concern about a patient. We know the values that drive us together. And we know that we're always improving individual capacity. So the outcomes, as I've got around the outside of my circular diagram there, that communication is clearer. We spend less time dealing with communication breakdowns. There's effective teamwork. People have each other's back. The organisation is responsive and adaptable to outside pressures. When stuff happens that we've got no control over, we roll with it. We know we've got we've got each other's back. We know we've got the capacity to respond to it. We deliver amazing consumer experiences. And it's that at the end of the day, looking at how we've managed to provide our patients and their carers and supporters with an amazing experience and great healthcare, that will drive us. So for me, the final thought is, if we're working towards a new normal, are we looking at getting back to normal, or are we going to really commit to becoming amazing? And I'll leave it at that point. Larry.
Thank you very much, Simon. There's a heap of stuff in there for everybody to consider.
Masses.
And having been a sales manager in a past life, a lot of that stuff would have been very, very handy to know at that time. And one of the interesting areas is we used to call the displacement strategy, where somebody would blame the company vehicle, but the company vehicle was purely a means of expressing their disenfranchisement or disengagement, because they could focus on that and rather than some intangibles. But thank you very much indeed, and certainly we'll sure have some questions later on. Our second presenter today is Shelley Thompson. Shelley is considered one of Australia's most respected authorities on patient-centered growth strategies. So we're talking now about people from a slightly different perspective. She has provided advice to a wide spectrum of health professionals and executives for over 30 years. She started very young, of course, and through her consultancy, Experience 360. Her book, Patients for Life, is a practical guide, and I mean that sincerely, to how to create a premium healthcare provider. So Shelley, over to you.
Thank you very much, Larry, and good afternoon, everybody. Larry, can you hear me okay? Yep, fantastic, thank you. I'm just going to do a very quick overview, Mike, because I'm conscious to give you plenty of time as well, because I'm excited to see what you've got in store up your sleeve as well. So my title of my presentation is really about goodwill in your organisation, and is that goodwill situated with the practice or the owner? And so for those of you here today, that own practices or are in practices, it's about maximising the goodwill across your practice. So what is goodwill? Well, in an essence, if you look at that first sentence, it is an intangible asset. So it's not something we can see and touch as such, but it does include the value of the brand and reputation of the practice, whether there's a solid patient base, and that's what I'm going to talk to you a little bit about today, and stable staffing, Simon's area of expertise, and do they have systems and processes in place that are actually transferable with the ownership. And so goodwill actually exists in a practice if it's maintained a competitive advantage and it generates above average profits that can be passed on. And being passed on to a new owner is quite critical. So you need to see some evidence around that, of whether there's metrics associated with it, whether there's a database that people can look at and pay for and inherit, if you like, or whether there's some sort of systems and processes that are transferable with the business when it's sold. And very clear to say goodwill, it varies from practice to practice. Some practices have very little and some will have substantial value, and that will be very much dependent on the practice owner or whether there's systems and databases in place that are transferable. So in terms of my question to you and the focus of this information being shared, my question is the goodwill of your practice with the practice itself or with the owner? And in this case, I'm assuming that the owner of the practice is someone, who is most likely to be a GP, you can see on the right there, and they normally continue to see patients and generate part of that gross income that happens in the practice. And the patients usually have a preference to see one of those particular doctors who may be an owner. but they certainly have a regular following, if you like, of patients. And therefore, that's what I would call personally generated goodwill, that it follows the doctor. And so that's really what we're talking about here, is the goodwill in your practice following each individual doctor. So potentially if the business is sold, once the doctor finishes a contract there, do the patients leave and move with the doctor, or do the patients stay with the practice? And that's what a potential owner will be looking at, is to whether that. So I'm going to focus a little bit on the practice side. I suspect the answer to that question that I've asked is that it's a bit with both. You know, for most of you on the call, I'm very happy if you wanted to type into the chat as well that, you know, where you think your goodwill is it with the practice or is it with the owners or doctors? And have a discussion about that. But I'll just touch on one thing that I mentioned in the definition of goodwill, which is really around the patient database. So do you have a good base of patients that are repeatable and transferable? And that's really about having a robust patient system in place. So I just want to share, I think one of the things that COVID has really shown us is that we need to be quite adaptable to the changing environment. I think that's something certainly that a lot of businesses outside healthcare do extremely well. They gather customer insights, they're able to process those quite quickly. They recognise that their customers have rapidly changing needs. They're creating platforms in which to capture those changing needs, and they're reviewing and keeping databases so they understand how their business needs to change. They're putting business systems and early detection or warning signs in place to say, oh, patients' needs are changing, we need to head off in that direction. And telehealth is a really obvious one of those in healthcare. So let me just share this one slide with you, and I'm just going to build this up because it has a fair bit of information about it, but it's really about helping you to understand how can we build within our practice a really robust, what I would call patient-centered system or process. And this is very much process-driven. Rather than, this is not a patient journey, something else I do a lot of, but we're looking very much from a transferable system perspective. So the first thing is, are we attracting patients to our practice? And in that attraction phase, you know, I've put a little magnifying glass. People might be doing search. They might be phoning a friend, so to speak. They might look on the internet. They certainly might be asking other people, you know, and getting word of mouth referrals. They might be looking through social channels or their network of friends, family or colleagues to ask for a recommendation about where can I go? You know, I need some general practice services. And so from there, that person that's looking for a healthcare service will be saying, okay, well, I'm going to jump on and have a look at something, which is usually via digital means these days in the virtual environment. There'll be a first impression of that website or that booking system or anything related to that practice through search. Then they might go on and go through the online booking system or a phone booking system, or even face-to-face if that's part of the experience. They'll be given some information, I suspect, on when the booking is, what you need to do, if there's any preparation for that, and then they will actually visit the system. And so now they're actually in the engagement stage of what happens. And there'll be, when they physically turn up to the practice, there'll be a consultation that will take place, some communication and interactions with people in the administrative part of the business as well, certainly be billing, and then will there need to be a referral on to another healthcare provider, or do I need to come back perhaps after I've had some diagnostic tests and repeat business? And the final part is, do I want to return to that practice? You know, is the patient, how has their experience been, and do they want to seek ongoing care at that particular practice? And so in terms of success metrics that practices can use, there's a lot of metrics I've put along the bottom. I'm not going to go through each of them, but certainly at different stages, you know, of the patient's experience, practices might be looking at different metrics to measure how successful they're being throughout this patient-centered system. So how many patients are we attracting? How many are we engaging? How many, you know, abort throughout the mission, if you like, to come to the consultation? How many arrive? How long do they wait? Certainly, how do we segment that database to understand more about our patients and our billing metrics, and then certainly eligibility for care plans, so for ongoing care. But I also want to introduce what I call patient metrics. I think the practice probably spends a fair bit of time looking at itself, and I'm hoping Mike will touch on this as well, there are a lot of patient metrics available as well. And that's certainly right through from what I would call web metrics or attraction metrics. You can see down the bottom there in green, certainly around that booking conversion. So at that stage, and then what was the experience like? What are the metrics we're using? And certainly in terms of reputational and brand metrics, Net Promoter Score is a key one to see whether people are likely to recommend or not. And so that just, I suppose, I'm just trying to whet your appetite. I'm going to stop there in the interest of time and just move on to Mike, because I think you can bring that to life a little bit, I think, in terms of the metrics that might be useful. So I hope that just provides a little bit of a feeling about how Goodwill might be valued in your business and how you might be able to maximise that value if you're looking to sell your business in the future. So Larry, I'll hand back to you.
Thank you very much, Shelley. Our final speaker, and I just want to actually just say something about what you mentioned about the patient experience coupled with the practice experience and metrics. And this is the concept of being proactive rather than reactive, obviously. Prevention versus treatment. And I think that's what you're meaning by the ongoing and have a good long-term relationship. And I think we've all had discussions about, you know, are we being used by the practice to fill their coffers, or are they actually looking at really working on our circumstances? But thank you very much indeed. So the third and last presenter is Mike Herman. I've known Mike for quite a few years now in other ways, but he's a founding member, founding partner of KPIs, which is a group of, as he calls it, like-minded individuals that really focus on data, and they understand that data is the key to everything we do. And it's from assisting us in making better informed decisions to compliance and governance, which was mentioned earlier with Simon. So data is the gateway to understanding a medical practice as well. And it's also about automating and streamlining the administrative process as best you can. But it's really the crux of this is really about analysing data to understand your practice in greater detail. So Mike, if you wouldn't mind, thank you very much.
Appreciate it, Larry. Thank you, and thanks, Simon, and thanks, Shelley, for having me on. Yes, as Larry said, we've been developing this platform for a couple of years now. We've got it in over 20 clinics and about 30 odd pending. And as Larry said, that the data is key. It's about knowing what's going into your practice and how to read it, and obviously pulling the data out and being able to use it in a way that benefits you from a revenue point of view, from a staff point of view, and just from growing your business, because let's face it, at the end of the day, all GPs are going to retire at some stage. And if you don't have enough data in your business to show what it's worth and what your patient base is worth and what the goodwill is, then there's no point just putting up a P&L and saying this is what my business is worth. So KPIs, we started a couple of years ago building the platform, and now we're rolling it out. We've got it in our MVP stage. So we've integrated with best practice, and we've integrated with Xero. We've custom built an API into Xero, so we can reconcile all your financials. We push information into the accounting system. We automate the process of GP disbursements, and we also automate the revenue component for bank reconciliation. We also generate a vast amount of KPIs and management reports for the GP owners and also the practice manager to use in terms of how they're running the practice. So we look at the DNA rate, we look at the billings rate, we look at the whole patient base, how active is the patient base over the last 24 months. We look at the gender part of the patient base. We look at care and opportunities within the database on a day-to-day basis, and it's all in real time. We can break down the doctor's treatments by MBS item codes in the various sectors, whether it's women's health or mental health or care plans or whatever the case might be. So we can analyse the business as to how it's performing. We look at the underbilling rate as to whether doctors are, doing a 23 instead of a 26 or whatever the other MBS item codes where they've got longer, because as we know, a lot of GPs leave their books open. So there's cases where they might be doing appointments of 35 and 40 minutes, yet charging at 23, which is the lowest of all the Medicare items. And so we show that within the KPIs platform in real time as to how they can perform better. So I'll just share my screen if I can, Larry. Where are we? 2 seconds. Pull this up. Okay. Can everybody see the screen there? All right, so this is the KPIs platform. This is a demo model, and we look at the overview of the practice to start with, so that any owner can come in on a daily basis, if my internet will let me go. And we can see what's coming in for tomorrow, the next 7 days, the next 14 days. The system's very dynamic. We look at the booking utilizations, average revenue per consult. We can look at the trend lines around revenue year to date, the appointments booked. We can look at patients by month, how they're increasing or decreasing. And then we can do it doctor by doctor as well. So I can click on the system here and the whole system changes to go to on a per doctor basis. And we can click back and it goes to the whole group. We can slice by year, we can slice by month, also the profession in terms of whether it's allied health or GP. And then we can also do it by practitioner as well. And I know when Shelley was looking at, what's the goodwill of the business, then, you can take your data back up to 5 years, because you might have a couple of superstar doctors in there that have been there for a year that can skew the data a little bit, or you might just have, a number of patients that have fallen off in the last 4 months that are not coming back, and you can pull all the data from the system, because as I said before, it's live and in real time. I'm not going to go through every single tabs because I could be here for another hour or so, which we don't, and we've all got time. But these are some of the metrics that we can look at around booking utilization, doctor utilization, the appointment KPIs. I know Shelley was looking at patient insights. So one of the things we can go in there is look at your active patient base, and what the RACGP says about the number of active patients, 3 appointments in the last 24 months. We can look at how the practice has been increasing on a month-by-month basis. Scrolling forward, this year versus last year, we can look at patients by gender, patients by month, and how it's coming through. And like I said, the data is really dynamic. You can slice through and pick and choose your months as well. So that's just one part of it. Around the billing optimizations, as I said before, we could also look at unbilled and not completed appointments, and also the underbilling and what the invoices are done on a month-by-month basis. Again, we can drill down into the data, whether it's a 23 or a 36, and we can look at some real-time value around what the doctors are doing. And again, we can do it by professional, by practitioner going forward. One of the things that comes up in practices all the time is around the MBS codes. And one of the biggest ticket items are around opportunities that the practices have. So again, we're looking at patient metrics, and what we do on a day-to-day basis, on every day, this will get printed off. So if, Mackay is coming in for a cold today, we know he's eligible for a care plan, whether it's a 723 or 721. And this is your big ticket items for any practice. So if you've got a 10 consult practice, just increasing by 1 care plan a week per doctor, it's worth another $200,000 to the practice. And then again, measuring the value or the goodwill of the practice, either before COVID is what the topic was, or after COVID started, we can go in and scan the whole database, on a daily basis and see, well, how many care plans, how many people are eligible for care plans, and then we can go back into the data and just see what the doctors have been actually doing from their work point of view, as to say, well, okay, how many have you done of these care plans? And we can go through every single doctor's on a case-by-case basis, or we can do it as a group to see whether they're actually doing these care plans or not doing it, or actually what the potential of the business is. So again, this goes down to, you might be buying a business and you can put the system in to see how many care plans are there, or if you're going to sell the business, you can look at this, say, well, my business is worth X amount because there are so many care plans available and there's so many patients available. Here's the patient turnover, et cetera, et cetera. So we monitor all of this in real time. We hit the system on a daily basis. We go into zero on a minute by minute basis. And, you know, when we go into the doctor's info, we look at the revenue items that the doctors are doing as well. We look at their appointment KPIs. We look at the average consults per month, how many days they spend in the clinic, the average billings by the practitioner and by the clinic as well. And we look at the revenue on a month-to-month basis, how it's increasing on a year-to-year basis. And we can break it down by doctor, by number of consults, or we can do it as the whole group. So they're just some of the things that we do within the practice, that we do around the metrics. And as Shelley said, around the Goodwill, you can track the data before COVID or after COVID, and there's a whole host of other metrics that we can pull out. And like I said, I'm not going to go into all of them, because we can also go into the financial parts as well, where we can look at the income statement, the doctor's payments, what the account payable and what the balance sheet is, because this is all in real time. So this will give you a real good feel for the structure around a business. So like I said before, whether you're buying it or selling it, or you just want to see where business is going for the next 2 or 3 or 4 years versus what's happened in the last 2 or 3 years as well. It's a very powerful tool. And as I said before, you're not fluffing up a P&L or a balance sheet. We're pulling the data live out of best practice. And at the end of the day, it's the data that they're putting into best practice that we're pulling out. So you can't have anybody going in there to mess with the data in any way, shape or form, because as we know, there's huge ramifications around that if you start messing with patient data and patient details on that basis. So it becomes a valuable tool, I guess, from Larry's point of view. If you're buying and selling businesses, you can put our system in there to see what it's doing. It also becomes an extremely valuable tool, as we're finding out from a lot of business owners, around how we are tracking around obviously what the business is going to do, perhaps in attracting more doctors, and also from a value of the business. I might be wanting to sell part, you know, all of the business, because, you know, we know a lot of junior doctors who want to get into businesses, but, you know, buying a 10 consult practice or a 5-room practice is way too expensive. But the in for them is to buy 5 or 10 or 15% of the practice going forward, and that becomes a great retention strategy for a lot of the GPs out there as well, around retaining good GP. Because as we know, it's extremely hard to find GPs at the moment, and everybody's, you know, screaming for them at this point in time. So yeah, that's the platform we've got there, and like tying it into, I guess, with all the metrics where you are at the moment, where you want to be, and obviously where you've been. The data, we believe, is king in pulling this out. And then once you've got all the data, and then in association with, I guess, your accountant and obviously the owners that are in the practice manager and any other advisors such as, you know, Shelley or Larry, in terms of what they're doing, then it becomes a real valuable tool of how you interpret the data and what you do with that data going forward. So I'll leave it at that. And if anybody's got any questions, then yeah, happy to go from there.
Thanks a lot, Mike. That was terrific. Thank you. I think, again, you know, collecting information is one thing, but it's making use of it is the second thing. And I think that's what KPIs allows you to do, is to actually have the data and make something of it, and improve your practice, improve the goodwill, improve the value of that practice as well. And I think that's where this really shines. And I'm very impressed. And I've said to Mike as well, that's a terrific system. So thank you all for the 3 presenters. Just to wrap up this thing today, this session has been recorded, and we will be making it available to all the attendees and sending it out more broadly. But what you've heard today, I think, for everybody, has been some practical ideas, some directions in which you can go to improve practices, and ultimately, as Mike said, result in better prices for your business, your practice, when you are in the position to sell it. And also, as Mike said, to sell part of it to junior subcontractors who have been working with you. From my point of view as a business broker, the more information I have at my disposal, it's easier to determine what the price of a practice is. And it also makes it much easier to present to the marketplace. And you get to a stage where you know what people will want. And this information that Mike Shelley is presenting is valuable to explain to the marketplace about the practice, because there's two sides to things. There is the factual stuff, but there's also the more of the narrative stuff about the practice and it's in the way it operates, etc. So net profit is important, and it's still going to be one of the prime reasons for people will look at practices. And Shelley mentioned about the goodwill as a maintainable aspect of it. But there are a lot more things to look at, and I think that's what we've shown today. And it's the people aspects, both from the internal, from the staff, the patients as people that you're dealing with, and also technology. And we've all seen that has some people aspects in it as well, with the doctors and the patient demographics, etc. So I'm just going to quickly share my screen. So from our point of view, from Xcllusive Business Sales, help is available on a number of different levels. Certainly we can value the practice or practices that you might be considering to buy or thinking of selling or whatever the case may be. And we also do valuations for unfortunate situations, like I've got one today that rang me about a family law matter. Those sort of things we can certainly provide a valuation to the various levels that are required. Obviously, we can help in the selling process, in explaining what is necessary to do that, what requirements are there, and guide you through that process. And thirdly, which I do a little bit of, and happy to assist, is if you're looking to buy a practice, we can certainly advise you and search out practices, evaluate those practices, and also even do negotiating if that's what's required at that level. So these are my details. More than happy to talk to all of you who've attended, and I'm happy to give you even my mobile number for you to ring me up on. So once again, thank you to our presenters, and thank you to everybody who has attended. And hopefully this will not be the first, but it will be one of many seminars that we'll be putting on through the rest of the year on various topics that will have some, and we hope, great effect on the way that people look at their practices and how they run their practices. So thank you very much indeed, and look forward to seeing you again.
Need help selling your business, buying a business, or a business valuation? Xclusive Business Sales award-winning team are here to help. Our experience, skills, expertise, and professionalism, backed up by our triple guarantee, is assurance for your success. A large network of buyers and our national coverage will help you throughout Australia in all state capitals and all regional areas. Xclusive Business Sales. Sell your business with certainty.